So, welcome, part 2, Plastic Surgery Unplugged, all about facelifts. So, in case you missed part 1, I introduced part 1 with a little kind of primer. Been doing this for a little while, just a little bit more than 18 years. And we made a list of the most common questions that patients ask us, whether it be on our DMs, on comments for videos, new patients who call over the telephone, all these different types of things. So we thought that we'd create a podcast episode that kind of covered these most frequently asked questions regarding facelifts. So we covered part 1, and let's go ahead and get cracking on part 2. So first question, part 2. How can someone maintain their facelift results over time? So a facelift is an investment. It's kind of like a car, or anything else, and it does require maintenance. First and foremost, simple things, sun protection. So a good quality sunscreen and good quality skincare are probably the simplest things to maintain facelift results over time. So some of the causative factors of facial aging, part of it is definitely genetic. Then there's a nutritional component. Okay, there's a personal how you are, body habits, all that kind of stuff. And then there's an environmental component. So the environmental component, I'd like to go, number 1, sun protection, sun avoidance, skincare, all right, don't smoke, okay, no drugs, that kind of stuff. Environmental component. Nutritional component. Make sure you have a nice, healthy diet. None of this crash dieting business. None of this like, okay, I'm going to lose 30 pounds in a week type of thing. Everything needs to be, all these things that your mom told you about. Live a healthy lifestyle. Exercise. Hydration. Okay? These are all really important things. Basic for health, and they will maintain your facelift results. Most important, skincare and sun avoidance, sun protection. Now we can move to the next category of things, okay? When we do a facelift, I do turn the clock back. It may take 15 years, 20 years off the clock. I am not stopping the aging bandwagon. You will continue to age. It's just that you will continue to age from an earlier time period. So a good example of this I like to think about is train stations. So imagine a train that's kind of going through. So let's say you're at a specific train station. I'm going to pick you up from that train station and drop you off at a train station 15 or 20 years earlier. However, the train is continuing to move. So I can't stop the train. I can try to slow the train down. And these are things like the sun avoidance, sun protection, skincare. Those are things that are helping slow the train down. Now, there's also some additional things that can be done during that time period. Some simple things that you may need to do. At about the 3 to 4 year time period after a facelift, I think that would be a good point to reassess whether there's some additional volume that's necessary. Okay, this may be a touch-up of doing some additional fat. That's an option. Maybe just a tad bit of filler. That may be an option. Some advanced skin restoration. That can include things like chemical peels, maybe a little bit of fractionated laser. These are all little what I call treatments that can be done in the process to further enhance those facelift results and slow the progression of that train. Another cool new tool that we have is the stem cell treatment. Every time I do a fat transfer, if I've got enough fat left over, I am doing stem cells within the skin. Stem cells are cells that promote regeneration and regrowth of tissues. Okay, so they work awesome. So if hypothetically we're doing a little bit of additional fat transfer or something to that effect, I may go ahead and add a little bit of stem cells, or I may even do an isolated stem cell treatment. These are all little things to enhance the results of a facelift and protect that result over time. All right, what is the cost range for a facelift and why is it an investment? Okay, $1 million question. Everybody wants to know, how much does it cost, right? Facelifts are very variable in cost. There are facelifts that are $12,000. There are facelifts that are $250,000. I'm going to tell you my kind of gestalt on how I do things at my office. A rough starting point for a facelift in my office is roughly around $20,000 to $25,000, somewhere in that vicinity. Okay. Now, The full facial rejuvenation procedure may be more. So that's just for the facelift. That includes local anesthesia and all the follow-ups. However, there can be additional costs, for example, if we're doing a brow lift, if we're doing upper lids, lower lids, laser resurfacing, so all of that. So there's a price range in there, and that range can go anywhere from about $20,000 to about $35,000, okay? And this is under local anesthesia with oral sedation, which is how I do about 99% of my cases. For cases that are done under general anesthesia, there's probably an additional, I don't know, $8,000 to $10,000 cost for the general anesthesia and the hospital fees and so on and so forth. So rough gestalt on this is we're looking at something that's in the $30,000 range. That's not a small sum of money. I'm going to say that straight up. I understand that is a relatively decent sized sum of money. So it is an investment. This is the reason why I take this so seriously, okay, in terms of prep work, in terms of prepping the patient, because I want the best, longest term, most natural result possible. So we really want our patients to go, wow, that was an amazing experience. That was an amazing result. And I'm going to hold on to that result as long as possible. So this is why we talk about things like how to maintain the result, how to minimize the motion of that train, and how to keep this longevity as long as possible. Okay, what are some non-surgical options that are available for facial rejuvenation? So not everybody needs a facelift, okay? Every person who walks into my office doesn't need a facelift. The vast majority, I'm known as the facelift guy, so they come in for facelifts. But there are a few that show up and say, hey, I don't think I'm ready for a facelift. And I look at them and go, you're absolutely right. So first stage of aging is when we have a slight amount of volume loss. So I think that some of the non-surgical options can start as easy as just one, skincare. Moving up the bandwagon or up the spectrum a little bit is probably a little bit of Botox. Botox is very good for softening up some of the lines, especially in the glabellar region, some of the lines in the forehead region, and the crow's feet region, okay? Fillers. I'm not a huge fan of fillers, but fillers definitely have their place. So patients that have, for example, isolated volume loss, very minimal in this area, I think fillers do a great job. I really like the hyaluronic acid fillers just because they can be dissolved, and I find that they have the least amount of tissue reaction. Moving up, if there's a little bit more volume loss, I really like fat transfer. Fat transfer, I think, is a great volume replenishing type of agent. I like it better than fillers, but I really, in order to do a fat transfer, I want someone to have a little bit more volume loss than just an isolated volume loss in this area. I'd like them to have some volume loss maybe in their temporal areas, maybe some volume loss along the jawline, something to that effect, so that I can target multiple areas with the fat transfer and maybe do a stem cell treatment in them. So those are some of the kind of procedures that are available. Some of the other things that are available also are the stem cell treatment that I've talked about a couple times. Skin resurfacing does a lot of stuff when we talk about facial rejuvenation. There have been several patients where I've done a good fat transfer and done a chemical peel, and they look refreshed. They're not ready for a facelift yet, and they look really refreshed and rejuvenated. So there's a large gamut of procedures that can be used in this range of patient where we can kind of refresh them. Maybe they just don't have the time right now to do a facelift or the funds or whatever it might be, and give them a pick-me-up without going through the facelift aspect of things. If that is one of you guys that are watching, I would like to caveat that with, I'm a pretty blunt individual. So if you come in here, I may say, hey, listen, I really think you need a facelift, and a non-surgical option may or may not really work for you, and you may not be 100% satisfied. So if there's someone who's further along the aging spectrum than a certain point that can be really helped with a non-surgical option, I really do think it's the surgeon's responsibility and ethical, what he's got to do in order to tell that patient, hey, I think you really are a surgical patient, and this is what we need to do to give you that result. And if you want to do this, you can, but you're going to get a suboptimal result. And I think that's a very valid candid conversation to have with patients. So everybody's on the same page in terms of expectations and all that kind of stuff. What sets your approach to facelifts apart from others in the field? That list is too numerous to count, but so I'm going to kind of break it down into a couple of different things. I think the first thing that I do very differently than a lot of different people is local anesthesia. Okay, I really like local anesthesia. And I like it for a bunch of different reasons. Number one, I definitely think that patients are quicker in terms of recovery rate, less bruising, less swelling, and easier to get back to their daily life activities. Number one. In my hands, and again, I'm caveating that with that little prefix there, in my hands, I feel I get better visibility with local anesthesia. So under local anesthesia, the patient's still available when I tell them, hey, I need you to lift your head all the way up or pull down or turn left, turn right. Can you kind of, blink for me and take a look? And so I can see real-time results. I like that. I enjoy that. So I think that that's a secondary reason I like the local anesthesia. So those are some local anesthesia, one big differentiating factor. I think probably 99.9% of surgeons use either general anesthesia or IV sedation where patients are kind of knocked out. Second thing, my approach to facelift surgery is I don't want to change who you are. I want you to look like you, only refreshed. Okay. What does that mean? So I want to basically turn the clock on you. I want a natural result. I think a good kind of story about this is, so for example, I have a patient and she says, I really want a lip lift. And I kind of talked to her multiple times about this. And I said, listen, I bet you really didn't have big lips or larger, more prominent lips through your entire life. She's like, you're right. And I really want them. And I said, are you sure? Because my beauty ethos, my mojo, my juju is that I just want to turn the clock back. I want you to look like you. And you never had large lips. So in an ideal world, I'd just take you back. I won't do this. And she's like, I understand you. I hear you. But my beauty ethos is, I really want more voluminous lips. I'm like, okay, cool. We can beg to differ. I just want to make sure you understand where I am. She's like, I got where you are. And I did do a lip lift procedure on her. Okay. But this is kind of my approach. I like natural results. 3, there's a lot of things that I'm willing to negotiate with patients on. When I say negotiate, beauty is not a finite entity. So what I think is beautiful may be different from what you think is beautiful, very similarly to that patient. So my job as your surgeon is to, 1, listen. Okay, listen to what you say. What is it that you think is beautiful, is aesthetically pleasing? Then kind of go back and go, what is my definition of beauty? Are both of those in synchrony with each other? If there is a disparity, am I willing to accept the fact of what you think is beautiful? Do I think that that's going to look good in you? Okay. All of these various things I think are very important that set us apart from a lot of different surgeons with respect to how we do facelift surgery. Last but not least, I do not see facelift surgery as an isolated procedure. I look at it as facial rejuvenation. The patients that get the best freaking results are the patients. So when we go in consultation, I sit down with them on a piece of paper and I write down, hey, this is what I would do. And I'm looking at the whole. It's the wedding cake model where I can bake the cake, I can put the cake in the appropriate layers, I can do the appropriate icing on the cake. And you look at these patients post-operatively, they get phenomenal results. Because facial rejuvenation is not a one-size-fits-all type of surgery. It really is what does this actual patient need? Defining those goals. And then, last but not least, not just translating that to surgery, but modification of the surgery for that patient's anatomy. So there's, every day I innovate with different brow lifts and all these kinds of things. Because why? because every single human has a little bit different anatomy. Just the other day, we had a patient who literally all she needed was the lateral portion of her brow to be elevated a little bit. The medial looked great. This lateral portion was down a little bit. So it was just from exactly the midline of the brow to the lateral portion that needed to be elevated. If I elevated the middle portion even slightly, it was going to look weird. She was going to look deer in the headlights. So we took the brow lift procedure and did a modification of the brow lift procedure that was specific to that patient because that is what she needed. So this comprehensive way of looking at things from the analysis, from the selecting the procedures, and then moving that along to modification of the surgery itself in order to fit each and individual person's anatomy, I think is what really sets us apart. And, we really continue to innovate. I innovate on a daily basis. So one of the things that you guys may be probably hearing about, seeing about on a lot of my social media and stuff is Elixir MD. Elixir MD is another way that we're innovating because it's not just modification of the surgery, it's modification of the entire patient experience because I want you to heal as quick as possible. I'm going to let you in on a little secret here. My end-all be-all goal, this is what I'm working towards, is to really go and take facelift and facial rejuvenation surgery to a 4-5 day downtime procedure. I want you to really be able to have a facelift on maybe Wednesday and on Monday be able to go to work, do everything you want to do, makeup, da-da-da-da-da. So this is my goal that I'm working towards. We've been able to cut that downtime, cut it down. And Elixir MD is another innovation that we're using to cut that downtime even further. So, this is what I think sets us apart from almost every other practice out there. Why do some facelifts look unnatural, and how can that be avoided? The vast majority of unnatural facelifts are caused by two variables, okay? One, selecting the wrong vector for pulling of the skin, and two, over-pulling. So facelift surgeons that are not very experienced or haven't done a lot of facelift surgery fall into a trap. So when women go and look at themselves in the mirror, every woman in the planet does this. They go, I look so much better when I just do this. Okay, that's great. However, the vector that we pull is not like this. Gravity pulls up and down. Okay, so if I pulled you straight horizontally, you will look like a dog with his head stuck out the window. It looks unnatural. It looks pulled and windswept. Okay, secondarily, if you don't release all the ligaments that you need to and release the muscles appropriately so that no tissues are under tension and you just yank the skin as hard as you can to compensate for the lack of release of these ligaments, you will get a pulled look. Okay? So these two variables are probably the most common reasons for an unnatural look with facelift surgery. And both of those are surgeon dependent. Surgeons who have a lot of experience doing facelift surgery don't have this problem. Surgeons who don't have as much experience doing facelift surgery really do tend to either pull in the wrong vector or over pull trying to compensate for certain things, which gives that pulled, unnatural doggy with his head out the window of a car look. All right. What is the ideal age to consider a facelift? Oh my God, golden question. There is no ideal age. I have done facelifts on people as young as 32, 33. I have done facelifts on women as old as 84. It is dependent on anatomy. A facelift is, we like to think of facelift as, oh, you must be old, you need a facelift. Doesn't work that way. A facelift is a procedure that has three goals: to elevate the midface, tighten the jawline, tighten the neckline. So let's say I get a woman who has a relatively heavier face. She's young, she has a relatively heavier face, and she says, I really just don't like all this fullness that I have in my neck. I want a sharper neck. I don't like the laxity, the fullness I have in the jawline. You're basically doing a facelift, okay? I'm not saying she's old. I'm just saying that that is the name of the procedure that I need to do to give that woman the results that she wants. So we need to get rid of that connection of facelift equals old, okay, and go facelift is a procedure that has definitive goals. So the ideal age for a facelift is truly dependent on the patient. There are some patients that will say, hey, listen, I want this result. This is what I want to look at. And they're getting basically a facelift. I apologize in advance if that sounds offensive, but it really is what I'm doing, okay? So we need to look at anatomy. We need to take a look at what the tissues are, what our goals are, and that defines the procedure. So there is no ideal age. Now, that being said, I would like to say that I like younger patients. Why? They're healthier. Their tissues are more robust. They've got more collagen. They've got more elastin. They've got all these different things. So therefore, the procedure, I think, is more fulfilling and gives a much longer, more robust result. So if I have a patient who has moderate aging, who is 40, 45, and a patient who says, I'd like to wait till my severe aging at age 65, I prefer operating on the moderate aging at 45 because I think I'm going to get a way better result. Okay, so this is my long answer, my short answer, and my personal biases when I answer that question. How do you help patients feel confident and comfortable with the decision to get a facelift? So first of all, I think a lot of this has to do with, again, a facelift is not you're old. Okay, let's take that whole paradigm out. It has no role in facial rejuvenation surgery. Okay. Basically, I like to tell patients, hey, listen, you're asking me to turn the clock back. You have a goal. And most of my patients, they use kind of the same similar catchphrase. They go, Dr. Othray, I do everything that I've always done, okay? Most of my patients are working women. They work. They go to their office. They go to, they have Zoom meetings. They're CEOs. They're administrators, all this kinds of stuff. They're working just like they've always have. Yet when they see themselves in the mirror, they go, the physical outwardly experience of what they see in the mirror and what they feel on the inside with respect to energy level doesn't sync. That's it. They're not sympathetic with each other. They're not in synchrony. So our goal is, let's go make that outside look as good as that inside feels. That is what we are trying to do. And when you can have these clear discussions, very honest, no whitewashing, no, pushing things under the rug, but just straightforward honesty and talk, these women have amazing results. I remember a patient of mine, she's actually on my YouTube, her name is Suzanne, and Suzanne made a great comment to me, and I won't forget that comment. She said that before she had her facelift, okay, the reason why she got her facelift was during COVID, she does a lot of administrative stuff, and during COVID, a lot of her work was changed over to a Zoom format, and she kept seeing her face on camera, and she's like, I need to do something about this. So she comes, we do a full facial rejuvenation on her, okay? And she's an amazing lady. I mean, she's energetic, blah, 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 the whole 9 yards. And she said something to me after surgery. She says, before surgery, I felt invisible. I could go to Home Depot or the grocery store, and people would just ignore me. They would just kind of not even notice me. And now I walk into a restaurant, and I see people noticing me. I see people recognizing me. I see people talking to me. I feel visible. And it really kind of changed the way that I think. I'd never heard it said in that way before. And she kind of changed my viewpoint. So I think, is this actually true? I don't know. I don't know where the truth meter is on that. But that is her impression of what she feels. And I hear this, though, over and over and over again. That patients, once they do this, they feel more energized. They feel, like walking around, seeing things more. They're doing more things. They think that people are interacting with them more. So long and short of it, to keep patients confident about their procedure, it's just sheer honesty. We just talk to them and give them realistic goals, and I let the results speak for themselves. What should patients ask during a facelift consultation? Lots of different things, okay? I think first of all, basics. Is your surgeon board certified? Okay. Does he do facelift surgery? Is he a specialist in facelift surgery? I would probably shy away from surgeons who are jack of all trades. There's a lot of surgeons who do 10 million different procedures. I think facelift surgery is very specialized. I think to be really good at it, you've got to be, you dedicate your life to it, kind of like what we do. So I would ask clearly, if your surgeon has results with all these things. Next, what type of facelift does he recommend? Why? What's the reason for it? What all is included in his facial rejuvenation plan? What does he want to achieve? What are the goals? So I think that these are things that need to be discussed very openly and very candidly. Despite me talking, I think in part one, I don't remember if it was in part one of this podcast or not, we talked about complications. I really think a good surgeon will talk to you very bluntly about potential complications. Okay, I have no problem talking to my patients about potential complications because it is on a consent form that they have to sign. So I really think that is kind of a gut check moment. What types of medications are you going to be prescribed before and after surgery? What is the anesthesia technique that is going to be used before and after surgery? So I think that these are all questions that you should potentially ask your surgeon, and will keep you safe, and will also, I think you should most importantly have a candid relationship with your surgeon. This is really important. So I like to have very upfront, candid talks with my patients. We don't shy away from that. So that I think, and you know when you know type of thing. It's like dating. When you find someone that you sync with, it's very you just know. How has facial rejuvenation technology evolved over the years? Facial rejuvenation technology has changed drastically. I'd say, so for example, there's some things that haven't changed at all. The deep plane facelift actually was invented probably in the 1980s. So that's quite a while ago, and yet we're still doing it today. So it's a procedure that has withstood the test of time and really works. Now, what has changed though is how we perform the anatomical dissections. All this is much better. So these are some very important changes that have happened. Preoperative assessment and preoperative preparation of patients, I think, is much better. Postoperative assessment and being able to give things like vitamins and Elixir MD. That's a revolutionary thing that we're really doing to enhance that postoperative experience. So these are, I think, some of the major revolutions in the surgical portion of facial rejuvenation. Now, if we look at the other type of facial rejuvenation time frame, there's been a couple of kind of major events. So in the 1980s, for example, surgery was really the primary modality of facial rejuvenation. Welcome in the late 1990s, early 2000s, injectables made a huge hit in the facial rejuvenation world. And along with that came in a lot of energy devices, RF microneedling, Thermage, Morpheus. All of these guys, a lot of these things are kind of really hit in that early 2000s. They have continued. And so that has really changed the facial rejuvenation, where for a long period of time, patients were kind of being diverted towards this non-invasive market. I think in the last 4 to 5 years, patients have really realized that this non-invasive market is not giving them long-term results like it promises. So we are kind of, the pendulum is now switching to the other side, where patients are really going towards surgical procedures because the technology is better. They're able to recover quicker, but at the same time get long-term results, which other types of modalities are not giving them. Last but not least, stem cell technology. This is kind of with the fat transfer. Fat transfer has been around since the 1930s. However, how we do fat transfer, small volume, small particle size with stem cells, this is some new stuff and it really works well. It's been around since probably the early 90s and is really revolutionizing volume replenishment and recognizing that volume is a key critical component to facial rejuvenation. We've covered about 18 of the most frequently asked questions about facial rejuvenation in 2 parts, part 1 and part 2 of Plastic Surgery Unplugged Facelift series. I hope this has been awesome, helpful, you learned something, all of those kinds of things. If you have more questions, hit us up. Our website, www.autrefacialplastics.com. That's a great place to go. There's a lot of information there. Check out our YouTube channel, social media channels, including Instagram, Facebook. Send us comments, send us feedback. Who knows? Your question may be on a future series on the podcast or may have a short form video on YouTube. So looking forward to meeting you guys, looking forward to hearing about your comments. And always remember that if you have any questions, hit us up.